This
2 weeks
conference will
with
now be recorded.
my video or my male doctor. So we'll see.
Right.
I mean, I do my lab work every other week. I'm sure she's getting the results. I haven't heard anything from her, so I mean, I do feel a lot better than I felt a couple months ago. But we'll see what she says.
So Al, how are you feeling right now?
Um, I wake up really groggy, really tired, fatigued. Sometimes it feels like my legs are gonna go out.
Mhm.
I just don't know from one day to the next, you know. And again, I talked about not knowing how much fuel I have and where I'm going to use it at. So if I scrub the pool in the morning, I'm done for the day sometimes, you know.
Sure, sure, sure. You think it's the drugs, the chemo
I
drugs?
hope that's what it is because I'm thinking that if it is the medication and I wean off of it, maybe I could get some of my energy back.
Yeah.
Have you told this to your doctor, who might be able to either change drug or dosages?
We are going to bring that up, and we did talk about it when we first met up there a couple months ago, that if the hydroxyurea wasn't for me, then we would go to the Jacopy.
Right.
But it's a more powerful drug. And of course, you know, if you jump up to another medication, there's always more complications and side effects to everything.
Yeah. And everybody's genetic makeup is different, and every drug seems to respond to us differently, doesn't it?
Yeah.
And so and unfortunately, it's a little trial and error. It's a lot of trial and error. It truly is a practice of medicine.
Kenny, you weren't online our last month, were you?
I was. I think I left a little early, actually, last month. Mm-hmm.
And one of the things I brought up, which was very interesting, is I asked about the medical marijuana, and there were about 6 or 8 individuals that raised their hands
Mm-hmm.
and have their cards and are doing the CBD oils.
Mm-hmm.
And of course, we all know it's not a cure, but yeah, there she goes. And it's helped everybody out. And what the heck, you know, what do I got to lose? I'm going to give it a shot, you know.
I think that's a great idea. Actually, it's funny you say that. So, an old college classmate of mine and fraternity brother, actually, he and another partner started up a CBD oil. Well, it was actually a split off of a distillery that he and the partner went in with, but they started a CBD oil production called Pretoria Fields. And so anyway, he sent it to me, and my wife has actually done it. And actually, my son's ascribed to using it for different things, aches and pains and ailments and so forth. And all, and he said, and the biggest thing that I've had with Revlimid is insomnia. And I know that it doesn't do anything else to me really, except, I mean, I get a little fatigued towards the end of a round, but I mean, I've been on this maintenance dosage for 5 years, but I do get insomnia. Of course, I have 3 children and a neurotic dog, so that might have something to do with it too. But so in theory, the CBD oil will assist with that. And not the neurotic dog with the 3 children, but it will apparently with the sleeping. And so I'm on week 3, I think, of trying this. And he sent me 2 different dosages. One is 45 milligrams per milliliter, and another is 65 milligrams per milliliter. And I do think that it's actually helping, although I have had some pretty funky dreams lately. But I don't know if that's really because of that or not, or if I was more psychosomatic on my part. But I do think it's helped a little bit, and I've been putting in a lot of miles too on my feet running. So I'm wondering if maybe it's assisting with that, because it does seem to be doing something.
Hey,
It'll help you.
tolerate the neurotic dog as well.
Right. Well, maybe if I need to be giving it to the neurotic dog. So
Tom, I wanted to ask you a question. You're the pharmacy person who happens to be here.
Richard, can I just break in for a second? Why don't we just all, in case not everybody knows each other,
sure.
let's just introduce ourselves and just check around, and then we'll come back to the pharmacy but I think each person should just at least say who they are and why they're here, what their disease is, and how long they've been working with it, and then we can come back and see what people have to raise, and we'll definitely come back to this your pharmacy issue. We'll kick off with that afterwards, and we'll come back to the CBD. So Kenny, why don't you?
Sure. Yeah, that sounds great. I actually was going to start with that, but I was thinking, well, I think actually all of us know each other here in some way, shape, or fashion. But you're right. Let's be formal. So, hi, I'm Kenny Capps. I am the executive director for Throwing Bones for a Cure, and our mission is to encourage, activate, and educate blood cancer patients to stay healthy and active through treatment. So, purposeful exercise is a form of cancer therapy. I have, I was diagnosed 5.5 years ago, almost 6 years ago, actually, going on 6 years, with multiple myeloma. And I went through a bone marrow transplant in 2015, been on maintenance Revlimid since then. So, which is, what's that, Jack? They call it a biological, is that right?
Immunological.
I thought it was called a biological, but I guess you're right. But
an IMID.
Yeah, right, exactly.
It's an IMID.
And it's an IMID. But other than that, doing well. I'm pretty active guy. I'll be 49 in a couple of weeks. So I know that I'm at the younger end of the spectrum, although nothing compared to probably what Jack was when he was originally diagnosed. Jack, you're going on what, 20-something years now?
Yeah, 25 years ago, but I was 45 back then. So.
Okay, so it's 43. So still that's relatively young considering the.
It is relatively young, yeah.
Yeah. So Jack, what about you? I'll tip my hat to you.
So I was diagnosed 25 years ago with myeloma. There weren't many treatments back then, so I've had lots of bone marrow transplants. 2 using my own stem cells. When that didn't work, I used my sister's stem cells. And that seemed to work. Been in a couple clinical trials, and probably the last 10 years, I've been heavily into the research advocacy mode. For the last 15 years, I've been facilitating our large Bay Area myeloma support group meeting.
Thanks.
That's awesome. Yeah. Hey, Al, why don't we shift over to you?
Okay, I'm Al Rocava, 60 years old. I was just diagnosed with polycythemia vera this year, about February, and just riding the wave now and see what happens, see what's next. I'm being treated at Mayo here in Phoenix, Arizona.
That's excellent. And so you were diagnosed just this past year, yes? Is that right?
No, this year it was.
Oh, this is 2020. Is it 20? Good Lord. It's still 20. Is it still 2020? Dear Lord.
We're still 20.
Unfortunately, yes. It's the longest year on record.
No joke.
Arizona, right?
Yeah.
Right, Al, in Arizona was still in 2020. I don't know about North Carolina.
Well, I mean, it's a different dimension when you leave the state. It really is. Sally, how about you?
My name is Sally Torgerson. I live in Santa Barbara. I was diagnosed with multiple myeloma 2 years ago in June by accident. I'm 75 years old. I had my stem cell transplant last year in March. I'm completely, stringent response, so I'm happy about that. I am an advocate for patients, taking care of themselves and, advocating for themselves. So I'm one of the myeloma coaches with the Myeloma Crowd. What else? I'm an avid researcher, so I make charts and lists and things like that. And I sent them to Lori, but she may not have passed them on. I have made charts of all the different drugs and procedures for multiple myeloma. I've made a 4-page, 235 listed acronyms that are used in myeloma. So if anybody wants them, I'll be glad to share them.
It'd be good for a rap album.
Right. I just, I really, there's no support group in Santa Barbara, so that's why I'm with this group. And that's why I'm here.
Right. I think I met you through the myeloma crowd, folks.
That's correct.
That's right.
And I know Jack through the myeloma crowd and the coaches, and we're also on some workshops together with some of the big pharmas.
Right. How about you, Tom?
So I guess tonight I'm the only CLL patient. We've had nights where we've been predominantly CLL. So I was diagnosed on a routine physical exam back in September of 2015 with elevated white blood cell count. And because of the deletion that I have, which subsequently I've learned it's a deletion that is common to both CLL and and that's a 17p deletion. I needed to start treatment in April of 16. And so I started on ibrutinib. I am a pharmacist. I've been a pharmacist for 41 years. I've been the chief pharmacy officer of 2 top 15 cancer centers, according to the U.S. News and World Report study on cancer centers. I write for the CLL Society and I do advocacy. And in July, I started my own blog, which is cllpharmacist.com. And so that keeps me busy. So at the moment, when I was the interim leader of those 2 places, that's what I was doing, was interim leadership in hospital pharmacies while they didn't have somebody to run the pharmacy. With COVID, I'm not real comfortable going into that without having to. And so since I don't have to, I'm not, not currently working that way, but I've done some recent short-term consulting assignments in hospitals, kind of have some legal and regulatory expertise that helps out in some situations. But, and then in February of this year, I started a second drug, pretty much based on clinical trials that were really successful, combining ibrutinib, which was the first medication that I was on, and venetoclax. And so I'm looking forward to September 17th, when I get my first test to see whether or not we have wiped out the CLL and that I'm in complete remission. So, I have really great numbers, and we don't know how long that will last, but I have a friend that was on a similar combination of drugs, and he's been without any CLL in his system for 3 years. So it's, it's really promising. So.
Well, I'm glad to hear that too. I'm always glad to hear that somebody's making some progress with this thing. I mean, it's so individualized. All right, last but not least, Mr. Farmer.
Dr. Farmer.
Dr. Farmer, excuse me, I apologize.
How about that? Hello, my name is Richard Farmer, and I think I've met you individually or during one of our sessions. I'm a psychologist by training and profession. Was involved in higher education my entire life. I am 69, going on 70 years old, and I was diagnosed with multiple myeloma 6 years ago. And that is as far as I know, and my oncologist, as far as she knows, is under control. the numbers are still vaguely present. But I'm on Revlimid, and that seems to be working, and I've been on that for the past 6 years. So things are okay.
Good. Well, actually, it does sound promising, Richard. How do you feel about that? Do you feel confident where you are right now?
Well, I do, Kenny. I think, when you look at the numbers and you talk to people and what have you, I think there's always a sense of caution, of over-interpreting. Jack, 25 years is extraordinary number of years to have been diagnosed with multiple myeloma. You're probably the oldest multiple myeloma patient in the United States. I don't know that for sure, but it's certainly extraordinary. When I was first diagnosed back 6 years ago, the average lifespan was 3 to 5 years. And at least that's what I was being told at that time. So I look at you and I say, well, my goodness, 25 years would make me pretty much 85 years old. And I can't quite see myself at 85, but one never knows at this point.
That's right. I mean, that's right. One never knows. So, why assume the worst when you can assume the best?
Exactly. Absolutely.
So just live in the meantime.
Yep.
Enjoy, live
Yep.
like my teenagers do, as if everything's cool and there's nothing to be afraid of.
Yep.
Yeah.
Kenny, I just got through drafting out an essay. I do some writing on the side, and this essay happens to do with adding meaningfulness to one's life for a cancer patient. And I look at that, partly as a psychologist, but partly as a patient, and working very hard to add meaningfulness. And how do we do that? And knowing what we all know, how do we do it? And by that I mean knowing that there is a lifespan. And Jack, you're going to be my hero because it's something for all of us to bear in mind. But it's out there, and so
yeah. One of the things. I'm sorry, Richard. Go ahead. I thought you were done.
No, go right ahead.
So you just mentioned something that kind of strikes a chord with me, and that's a lot of CLL patients really are looking for information on about what their longevity will be and their survival and stuff like that. And one of the things that's real, and it may not be as applicable to myeloma as to the CLL patients, but a lot of the data that's out there is old. I was on a pharmacy continuing education program just 2 months ago, and the pharmacist that was the moderator gave information about people with 17p deletion like myself, who, yes, before all these drugs that are new within our treatment regimen came along, life expectancy was 2.5 to 3 years once you're diagnosed with the 17p deletion. But the new drugs, I mean, according to him, I've been dead for 2.5 years because I'm 5 years post-diagnosis, So I think that there's been a lot of progress, and we've got to be really careful not to use Dr. Google to find our information about, any kind
Absolutely.
of, what is the overall survival rate and the prognostic, indicators of how long you'll live, because so many new treatments and stuff. I was just reading a couple of things that came across my desk in the last week or 2 weeks on myeloma, you know, and I said to myself, damn, I Kenny or Richard's email to send these guys these new articles about promising studies that are out there. So maybe we can share that before the night is over, but
Yeah, Tom, you know, I 100% agree with you. When I was first diagnosed back in 2014, I was told that there were fewer, vastly fewer than 100 clinical trials that were going on that were approved by whoever approves the clinical trials. Today, I understand, rightly or wrongly, but the number is closer to 1,000 for multiple myeloma.
Yep.
So yeah, you know, it had been ignored. It had been ignored by the oncology community for years and years and years. And you know, here we are saying, well, you know, wait a minute. You are driving all of us nuts with these end of life issues because we're all sort of, except for Jack, we're all sort of waiting, you know, for the knock on the door. And, you know, we've done whatever we've done about that in our lives. And so it's very important in my view, very, very important to be able to say to Al, who's just been diagnosed, if I caught that right, Al, wow, you know, you got a lot in your mind. I get it. I get
So
it.
if I could interject, when I actually, at the same time that I met Jack, actually, it was I guess it's what, 2 years ago, I think, in Pennsylvania. And so I also met another person, Yalik Baru. And so Mr. Baru has had it for not quite as long, but really close, I think, right, Jack? I think 22, 23 years, something like that.
Almost 25 for him. He's
Yeah, so you guys are real close.
about 6 months difference.
Right. And I think he was a little bit younger when he was diagnosed, maybe even in his 30s. Is that right?
He was a lot younger. He was 25.
25, right. And he's had it for about the same length of time. And I say this because also so much of what we're seeing as far as the mortality or mortality rate or life, expectancy after diagnosis is somewhat skewed. And I take this, and granted, this is anecdotally, but take this somewhat from my mother's experience. My mother is a retired physician. She was an internist, and most of her patients were over the age of 60. And so she had patients, certainly back in the 90s, who were over 60 years old, who were diagnosed somewhere around that time while they were her patient as having multiple myeloma or CLL. And they also saw these same things, but she said she only had a small handful of those patients, who actually passed away because of the disease. It was usually some other underlying condition. Now, granted, those underlying conditions could have been exacerbated by this other blood cancer, but she said it very often was because of another thing. Now, granted, there are, again, more aggressive and more and less aggressive versions of the same disease based on your own genetic makeup and, of course, the genetic makeup of the disease itself. We're discovering this some time later, but you're right there. But since then, and again, this was 25 years ago, probably, that even Mom was talking about. And it's changed dramatically. There's so many different options. Even in the past 5 years, the different studies that have come about, as well as the different drugs that have been approved, moving into the third, second, and then initial tier of treatment. It's crazy. And that's just in the past 5 years or 6 years that I've been paying attention to this. And so there are so many opportunities. So there's no reason not only is there no reason to lose hope, there's never any reason to start out without it, as far as I can tell. And I understand that there are exceptions, and there's some terrifying things that go on. And this is a scary situation that we're all in a lot of ways. But there's a lot of possibilities. So anyways, that's just sort of, that's my take. And again, I understand we've all seen anecdotally people like Jack and like Yuck who have lived for years and years and years with this disease, which gives us all great hope. Now, that's not to say that Jack hasn't worked his tail off to live for the past 25 years. He's been through the ringer. I mean, 3 bone marrow transplants. Whoo! I didn't like the one. I'd rather not do it again if I can avoid it. That was not one of the more fun things I've ever done. But I would if I had to. And I'm sure, you know what? I bet you the second and third one were way more fun than the first one, though.
You know, it's interesting. I had a person on one of my Facebook support groups that said, you know what? I think I should just get a bone marrow transplant and be done with it. Be done with CLL. And I said,
There you go.
you have any idea how much that is? And there's no guarantee that it's going to be curative. You know, you might get a remission, but you may not get a remission that's longer than the less toxic oral drugs that we have available today. So, but to wish that you could get that and just say, oh, it's going to go away, like I'm going to pick this candy bar today instead of my regular candy bar. That was my impression of what he was asking for.
Yeah, it does. It's not magic, that's for sure. And it's,
Yeah.
I never hit remission. And again, as fun as it was $130,000 lighter, and that's actually just for the actual thing, not to mention all the other stuff that was the build up to the fun. And you know, and I was in the hospital I was in for about 5 weeks. I know a lot of people go a lot less than that, but there are plenty of people that go a lot longer than that too.
The shortest I've heard is 30 days. So, you know,
I was only in for 12.
Yeah,
Really?
I've heard people that were in for a lot less than that.
Wow.
They actually let me out at 3.5 or something like that, but they revoked my parole and sent me back because I passed out as soon as I got to the hotel lobby. I spiked a fever of 105 and made me go back in for another week and a half. Because I thought it was free. I thought it would be one of those guys that got out early. I was gonna be like Sally. I was just done early. That was
And I had mine as an outpatient, so I really never stayed any overnight in the hospital at all.
Oh,
You know, went back and forth, and I was out, you know, had afternoons and evenings free. And if I felt good enough, we took drives around Pasadena and, you know, went home on the 12th day.
You are one tough lady. That's awesome.
Thank you.
That's fantastic. Yeah, I mean, you know, I felt like I was going into this. I was how was I? 42, 43, and I felt like, and you know, I was running ultra marathons and super athletic, and I like I'm a badass, and yeah, no, I kicked the shit out of me. I lost 14 pounds in 10 days or something like that.
I gained 7 pounds.
What?
I gained 7 pounds, and I was there on my 74th real birthday.
Good Lord. Yeah, no. I did not have the same experience as you did, Sally. That was not my experience. Although it was really cool. Jimmy Carter was upstairs. He was on the floor above me. He was actually
Wow.
because he was having a similar procedure upstairs. Actually, and that was actually the transplant floor. I was actually on one below it, which was kind of mixed with other people, but a bunch of bubble people that we weren't allowed to sort of be out of our rooms at the same time. They were kind of doing laps because they were being super cautious. While they gave us that lovely massive dose of melphalan. Woohoo! Good times there.
I also had half a dose of Melphalan because of my age. They called it Melphalan Light.
Diet melphalan. Nice. No boy, no. But you know, but now again, 5 years later, and again, I did not hit remission. When I got close. They said initially it was very good partial remission or something along those lines.
What's your fish score?
I actually don't know the answer to that. I know I probably should know the answer to that. I know it.
You don't know your
I just track my input. I track my M proteins, and then my plasma count when I have my annual biopsy.
You
And so
don't
my
know
M
what
protein,
you don't know your genetic cytology?
I don't, and I know I probably one of those things that I probably keep track of. But where I'm staying for the past 4 or 5 years, I've lost track of all that stuff. It just don't, because they're not paying attention to it, or at least they're not telling me to pay attention to it. So I just kind of, so no, I have, so my M protein hovers around 0.8, and consistently, and has for really past year and a half, 2 years. And so they're just like, yeah, that's good. If it starts consistently going over 1, it's gotten to 1 a couple of times. But if it ever goes consistently over 1, they're like, then we'll start looking at it. I did have my biopsy actually just 2 weeks ago, and I just got my call this morning, and they said that the M proteins are fine, so blood work is good, but they said my plasma is up 15%. They said so.
Plasma what?
My plasma, the percentage of
Protein?
yeah, so it's up by 15%. So
So
they
your
want me to go
serum
have
protein. What's your urine protein?
Oh, I don't know. They didn't tell me that. No, I have no idea. No, they told me that my my plasma is up by 50%, and so they need me to have a PET scan again, because I haven't had one in 2 years. So it's been 2 years since I've had a PET scan. See if anything else new lights up. So that's always
How do you
fun.
feel?
I feel pretty good, actually. So yeah, I mean, I don't, as far as I know, I don't have any unusual aches and pains. I won't say I don't have new aches and pains, because I always have new aches and pains, but I don't know if that was self-inflicted or whether it has to do with anything else. That was kind of the problem last time. Last time I said, it's just normal stuff, and I ended up having 2 compression fractures in my back, and I had a lesion in my hip and my collarbone and everything. So I just kind of got, I was chewed up. I was having headaches, and it didn't equate it to the fact that I got holes in my skull too, lesions in my skull too. It just didn't occur to me. That wouldn't have occurred to me. So, and I can't see that stuff on X-rays.
Let's pull this back a little bit. I want to go back to Al, because when Al got diagnosed, he and I talked a little bit about being very careful with Dr. Google and
Right.
looking at longevity and overall survival. And I even though I know very little about blood cancers, I do know that with most cancer, people respond differently. Everybody's a little bit different. And when you look at these overall survival numbers, they're general numbers. And it's only a guide. And so I love hearing what you're talking about here with respect to overall survival. And of course, Al's dealing with polycythemia vera, so that's a different situation to MM. It's a different situation to CLL. The drugs are a little different. He's at a fantastic treating facility that happens to have a specialized group for what was it we thought you had originally?
Originally, myelofibrosis is what 2 doctors.
Right.
Myelofibrosis is what 2 doctors originally, no, it was Manda and the doctor from Banner told me I had myelofibrosis. Up until I got up to Mayo, the Dr. Palmer up there told me that she would treat me for polycythemia vera, which she believes I have, instead of myelofibrosis, which is a lesser cancer of myelofibrosis.
Yeah, these are all myeloproliferative neoplasms. And there's the third one as well. I don't remember what it is. But Al, if you need a resource, one that focuses on MPNs is called patientpower.info. And the founder of it, Andrew Shore, has myelofibrosis, but there's a lot of information on MPNs on that website as well. Patientpower.info.
Yeah.
Yeah, I'll put that in.
I think Andrew's a little unique in that he has that coupled with CLL. So
Yeah, but the CLL was, yes, but they were diagnosed considerably years apart. But yeah,
yes, correct.
So, yeah, and by the way, Al, Michelle does a lot of videos and interviews and I don't know what else on Patient Power. So we have very good access, and I know Andrew too. So we have very good access, but it is it's a good website because it's very patient centric. So it's all the time it's thinking about how do we explain it to patients who don't know much about this disease. They don't assume that people have the level of knowledge of Tom or Jack. So they will dumb it down for people who just got diagnosed, and they'll explain it. And of course we have to mention that our moderator, Kenny Capps, just got featured in an interview on Patient Power as well. Is this not true, Mr. Capps?
I believe it is, actually. Thank you very much. Yeah, that's awesome. Yeah, in fact, actually, I was on they took a video of me. It was crazy. It's actually very fun, made me very jealous because the interviewer was on a boat in San Diego, in a harbor in San Diego while he was talking. It was almost cruel, actually.
But
He
you
said
know,
you-
I think
Yeah.
the take-home message I really want to give Al is that don't be driving yourself crazy from what you read on Google. You know, yes, it can help. Yes, there's some information, but you've got to know the source of that information. And what might be true for somebody ain't going to be true for you. So, you know, I think that's the take-home message. Well, what would the rest of you say about that? To somebody who's
Also
just
be careful about how old the information is, because the information on Google is a lot of times very old.
And they don't tell you the age of the article, and or it's very, very hard to determine what the age of that information is. So I would definitely say Google is not a good source. You use Google, I would look for, if they direct you to a website, look for websites that end in edu, which means an educational facility, or gov, which means government. But stick away, org usually means a nonprofit. So you can get things like the Leukemia and Lymphoma Society, that's an org. But anything that's COM, unless you really are comfortable with that site, I kind of stay away from that to try to get my information. So there's kind of a tendency to find that there's a ton of information. We have, I think, in some cases, too much information available, and we get information overload. And then it's, well, what really applies to me? And that's not an easy thing to do. I mean, here I am, I'm a pharmacist. I was diagnosed 5 years ago. So at that point, I had 36 years experience as a pharmacist. And I'll tell you, I mean, what I've learned about CLL has been in that 5 years. I mean, I heard about it, I knew a little bit about it, but the individual drugs and how they work and all of that stuff I've learned. But I also have the benefit that I've been taught how to read a research report and interpret a research report. And not every person can do that.
Absolutely.
Right. Do you have a suggestion for maybe those of us that don't have science or medical degrees and backgrounds in order to be a proper advocate? Because I'm assuming it's not necessary to have that sort of educational background in order to be a good advocate for oneself.
Right. Well, so there is a separate website called Google Scholar. So it takes you to the more scholarly articles. So I think that's a better place to look than just plain Google. So it's scholar.google.com. So, and then you can put in multiple myeloma, or you can put in, whatever blood cancer you're looking for, and then you can narrow it down. With Scholar, you can say, only tell me things that have been since 2020, or only tell me things that since 2019 or 2016 or forever. And when you get forever, you can get stuff from 2000. Well, my drug, the first one I went on, was not available till 2015, and it changed radically how CLL is treated in this country. And most survival data is 7 years behind. And so that drug's only been out 5. So we don't even have current survival data.
I actually would have guessed longer than that, Tom. I was thinking more like 10 or more. I know
in some cases it is 10 years old because there's really been no change. But rule of thumb, when you read some kind of survival data, always think to yourself, it's at least 6 to 7 years old.
Another thing, Kenny, is that I was asking you what your genetic cytology was. And that's important in myeloma, especially because some of the drugs and some of the treatments are better with some genetic differences than others. Like I'm 1114. Venetoclax, which is a new drug for multiple myeloma, works beautifully for that, but does not work for 1114, for instance. And it's important to know that, and things like Spark Cures and Myeloma Crowd Health Tree and All for Cure and some of these other websites that can track your treatments and your responses can then point you to clinical trials if and when you go into relapse or become refractory to Revlimid. And it's very important to know and become an advocate for your own personal disease. And that's what it is. MM is a very personal disease.
Yeah, that's very cool.
Of course.
Sally, are you on venetoclax?
No, I'm not, because I'm in stringent response, but I've read about it because I want to be prepared because I don't know when I will become refractory to Revlimid.
So
I'm a researcher. I mean, I have a degree in biochemistry, so.
So I am on venetoclax in addition to being on ibrutinib.
And I can't wait to hear next month how it's working.
Yeah, I'm hoping that we get really good results, but it seems to be very promising. Fairly new, if I recall. It's only been like 2 or 3 months that they've been talking about, maybe a little longer.
July 21st.
Okay, I was pretty close.
Mm-hmm.
So that venetoclax potentially.
Well, it was taken off of it was approved for the phase 3 trials, and then the FDA dropped it and stopped it in May. And then they reviewed all the data again and found that in myeloma, at least, that it was significant in the translocation of 1114. And that's the only one that it's approved for phase 3 trials. But everybody else has to wait until they find out what the problem was. There were a higher incidence of cardiac problems.
Mm-hmm.
So
this is a drug, what I'm hearing is this is a drug that's used both in CLL and for MM.
It's actually approved for CLL. It's not approved for MM.
Yeah, it's not approved. It's in phase 3 trials for MM. But 1114 only.
Okay. I want to come back to Richard, because Richard, when we cut you off to introduce everybody, and you had a question for Tom.
Oh, heavens. I'm not sure I can recall what the question was, Tom. I'm sort of embarrassed.
CBD oil.
It was what?
CBD oil or marijuana?
I don't think so. Um,
Well,
no,
that's what
whatever.
we were sort of talking about CBD, and then you said, "Oh, I want to ask Tom a question," and then we jumped in and interviewed it and went around. Well, if you remember what it is,
I'll buzz in.
put it in the chat window, and because I didn't want to take your question away from you.
Thank
Thank
you.
you for that, Rick. And actually, I just want to respond real quick to Sally. So I know I was rather blasé about my genetic makeup, and honestly, part of the reason why I've been somewhat, and I do pay attention when these studies come out, and I pay and when read a lot of the papers when they're coming through. The reason I've actually been less concerned about my own is because my situation is not changing. So the numbers, the markers that I'll be watching as far as coming out of this, and you're right, I'm not being prepared. I'm not adequately preparing myself for if things were to change. So mine is I know that mine is of the most common type of most common genetic marker type of multiple myeloma. I do know that.
Probably
And
1114
1114, I believe it is. I think you're right.
with no deletions, yeah.
And so,
But since you did not, since you didn't achieve a complete response, you might
Right.
have a deletion 17, a P17.
I don't know the answer to that, but I do know that Revlimid is maintaining this 10 milligrams of Revlimid. I'm responding to and to see at least that it's maintaining and has for 5 years now. And
That's
so,
great.
and I know that they're not going to, which is a little bit slightly past the sort of, I think, the median now time period where you fail on Revlimid. So, I mean, I know that they have people that have gone as long as 10 years, but that's usually an outlier. So
Yep.
I'm a little bit past the normal on that. And so they're going to ride this out with me as long as we can, because it's, I'm still having quality of life, and I'm able to do the things that I want to do on this drug. And I do love the fact that it's oral and I don't have to go in and have an infusion that often. So, in fact, I just got off of Zometa, so very excited about that, which is nice.
It's a,
I'm looking forward to the latest thing that I've heard from my specialist is that because I am MRD negative and they are recommending that I stay on the Revlimid for just 2 years and then, check again for my MRD status and then take me off of it. So I'm looking forward to that.
mhm.
Yeah, I bet you are.
Kenny, how often were you getting Zometa?
Well, it started out, I was getting it, I think it was like, initially it was like every 2 weeks, but that was just for a couple of like 2 or 3 months. And then it was every month. Then they moved it to every 6 weeks, and then they moved it every 3 months. And so
Wow.
recently I was on every 3 months until I had a lot of lesions. And so I think they were being overly cautious about it. And also I wasn't having, and I know that some people have some negative responses to Zometa also, and I wasn't. And so they said, watching it closely, doing the dental checkups and all that. But
Yeah.
but they said after 5 years is probably about the max.
Kenny, do you realize that Zometa has a half-life of 10 years?
Yeah. It's very, very,
I have
very long half-life. I actually got Zometa when I was in treatment, but I didn't need a lot, and it was effective for me. So I got 3 treatments over 2 years of Zometa because I was osteoporotic when I was diagnosed, and they just gave it me as a support. But we've got a lot of guys that have been on Zometa, and we will encourage them to go from a 6-week to a 3-month regimen. And, we tell them you can talk to your doc about taking a break because it has such a long half-life.
Yeah, and that's what they said. They said honestly that he didn't see the value of going more than 5 years at all, and so that was when he said, "Let's just go 5 years and then that's it." And I've been on 3 months for, it's either I think 2.5 or 3 years. I've been on 3 months on the 3-month cycle, so it kind of quickly went to that the 3 months cycle. So, and I hadn't had a problem.
this bone thinning am I right in saying it's an issue that is peculiar to multiple myeloma, or is it true is it true for Al with polycythemia vera, or for Tom with CLL?
Myeloma.
It's a myeloma thing. So what it does
Myeloma
in
thing.
theory, I mean, correct me if I'm wrong here, but so it essentially the myeloma itself it actually shuts down your osteoblast, which is the enzyme that helps you create new bone. But unfortunately, it does not shut down, or unfortunately, it doesn't shut down your osteoclast, which actually takes away the good bone because you're not getting any of that. So that's when it starts to create those lesions, those holes. And so, of course, the treatment that we would get, whatever either the chemotherapy or that we would get, the Revlimid and so forth, its purpose, of course, is to shut down, is to let it do its thing again. The osteoblast can come back and start building new bone again. And the Zometa often gives sort of shuts down those stuff that's taking away the old bone, so that you can really sort of amp things up a little bit, gives it a little bit of a turbo boost, or at least it's not fighting itself in order to get back to normal. Or as normal as
And
it
that's
can be.
why
And
one of the CRAB markers is a high calcium level in your serum.
Yep. So yeah, that is a myeloma peculiarity. Although I do know I've met several people that have never had any bone involvement in myeloma, which is interesting. But then I have people that have had these strangest bone involvement. A good friend of mine actually here, she's a physical terrorist at the hospital in Nashville, and she has two big dogs. And she was walking her dogs in the woods one day, and one just happened to pull hard to the right, and it broke, her arm broke right in the middle.
Oh my God!
Right in the middle. And
Wow.
so they went in. They said, "Well, that's a strange break." And they went in and they found the lesion. But then they did a full body PET. She had the same lesion. It just hadn't broken on the other side. It was a
Wow.
mirror. Yeah, crazy. So
I was pushing myself out of a chair and dislocated my collarbone right there.
Oh.
And, I went to the emergency room, and of course they said, "Oh, there's nothing wrong. It's not broken." Well, 2 days later, I went to my orthopedic surgeon. I said, "This is not right. I did not have this large bump here, 2 weeks ago." And I convinced him to stop looking for horses and start looking for zebras. And we went and did a CT, and he called me 2 days later on a Saturday, and I knew wasn't good. And he said that my collarbone looked like it had been eaten by a mouse.
right. And the funny thing is, you probably can't see it in an X-ray. That's when they were telling that you aren't seeing it, because X-rays are 120, 130-year-old technology, something like that.
Yeah.
And
it wasn't broken. It was just dislocated. It was actually the sternoclavicle joint that just separated.
Yeah,
So.
yeah. They couldn't tell whether things were fractured or whether there were lesions on me at all from the X-rays. The only thing that got it was that I had such a large lesion in my hip. They're saying, "It looks like you have a mass there. So let's find it. Let's check that out." And so then they went deeper and did. I think they actually started with an MRI and not a PET. And that's actually what did it.
So
Yeah.
go back to your insomnia.
Mm.
So with your bone issues, do you take a lot of vitamin D?
I do, actually. You think that maybe that has something to do with it?
So do you take it at bedtime?
No, I take it in the mornings, actually.
Okay.
Yeah, I'm pretty diligent about that. The only thing that I take it at night is things that I know is going to make me sleepy. I learned from my dexamethasone days to try to take Sally knows. To take that stuff as early as possible in the day, and then plan on not sleeping until sometime 2 days
Well,
later.
Dex could be doing it, but
I don't do that anymore.
Vitamin D also doesn't.
Interesting. I didn't know that.
I didn't know that either.
So, it's like all of a sudden you put a big bolus of vitamin D into your body if you take it at bedtime.
Yeah.
And when does our body make vitamin D naturally? When we're in the
Daytime.
Right?
Interesting.
And so it
That's a-
tricks our body into thinking the sun is out.
Yeah.
Sure.
And
Glad I
safe,
take it in the
I
morning.
hadn't thought about it.
and we should not be asleep. So yes, take your vitamin D in the morning.
That's a good theory, though. I had never heard that, but that's.
Well, I
that's
was
so-
having problems because I was taking it at night, and I said, what is causing me this crazy ass insomnia? And I went and looked, and I said, sure enough, there it is. And so I had never heard it either. So, but I did the research, and it said in some people it causes insomnia, particularly if taken at night. So
That totally makes sense, and I don't know why I never thought about that. That's
Yeah.
actually makes a whole lot of sense. But thank you for
Yeah.
that, Tom. Yeah, that's excellent. The other thing, of course, true confession is I am a very light sleeper, and so so it doesn't take much to wake me up anyway. So that probably doesn't help.
mhm.
And again, did I mention the neurotic dog and the 3 children? But they're noisy
Yeah.
dogs. They're stomper. I think the younger and smaller they are, the louder they are. It's incremental.
I take my Revlimid at night, and actually it helps me sleep. But I also take Cymbalta, so it may be that.
Cymbalta. I don't know what Cymbalta does.
It helps my peripheral neuropathy.
Mhm.
Okay.
I
So
don't
are
like
you still having that?
I have some, but some of it's from I had my knee replaced in February, and they nicked a nerve, so I've got nerve damage from that, and so it helps just with this weird numbness in my left leg.
All right. Do y'all have any issues with that? Richard, did you have any issues with neuropathy through all your treatment?
Yeah, I have a whole host of side effect issues, just kind of all over the place for me. Some insomnia, and I'm sort of bouncing up some of the drug that I'm on that will help me. I take Dex every Wednesday, 5 at a time. And so come tonight, I'm pretty wired. So if I could take some other meds that will help to kind of bring that down, that works. But yeah, some odd feelings here and there, some bone pain. When I was diagnosed, I had lost 45 pounds and 5.5 inches of height because the little buggers went after my spine, and it just twisted my spine over. So I lost a lot of weight and a lot of height. And much to my grandchildren's great delight, they're now taller than I am.
Richard, do you take Claritin?
I beg your pardon?
Do you take Claritin for your bone pain?
Acetaminophen?
Claritin.
No, I take a whole host of other high-end drug pain stuff.
Claritin's over the counter, and it works for bone pain.
Okay. Is that well?
It's actually an antihistamine.
Yeah.
Why it works, I can't tell you, and it doesn't work for everybody, but a lot of people say that they get relief from bone pain by taking Claritin.
Just once a day in the morning.
It's interesting. I had several people tell me to take that before they actually had their Zometa treatments. They would take.
That's also true.
Yeah,
That and Benadryl.
yeah.
All right.
Yeah.
The Benadryl knocks me out. I mean, that's like you basically just gas me if you give me.
Benadryl does not help with bone pain. Claritin only.
Yeah, I would have to tell you that I'm on some pretty heavy-duty narcotic painkiller.
Sorry, that's
because, otherwise, I would not be with us tonight and would be in the sea, just because it's extreme, because of where I was attacked by the when the cancer went wild and went humping along, landed on my spine. And
So I
that
see
was,
Michelle's joined us, and I believe she gets the Best Dressed award for tonight.
Heck yeah.
I thought I did.
You did until the billions came out.
Sally, you do. I'm just holding on to every last bit of summer I can.
You do look very summery.
Thank you. I'm trying. Well, we still have good weather up here. Our days are numbered, I think. What do you think, Richard?
oh, you look like a typical Bostonian. What can I say?
I don't know if that's good or bad.
Having spent more years of my life in Boston than I care to think about, Michelle, you look like typical
I don't know.
Cambridge, Boston. Yeah, I
She
got
came from the Hamptons.
I'll take any of it. Here
I'm
I
gonna
thought I
have
looked
to
like I was in
I'm gonna
Florida.
have to get my tuxedo out next month.
Where are we going, Tom?
We haven't been any place since Orlando last year.
That's a good point. No, I did go to Florida the next month for something else, but Yeah, I know. there will be no Ash in person this year, unfortunately.
I know.
There's a lot of things changing. No healthy voices even next year. I saw
Yeah.
the cancer
Wow.
2021 already. Yeah, yep. It's a whole new world.
It is kind of odd. They're already calling it off, but I don't blame them. It's crazy. There's other things I see that are supposedly still happening, but I don't see how they will as early as January. I think that not for Healthy Voices, but something else. I don't know how any of these things will happen that soon. It is a
I
whole
don't think
new.
anybody really understands how much work goes into getting one of these conferences off the ground and how much advanced planning there is. So, we're already planning next July conferences in some places. So, yeah, I can see how not being where we are now for January or February, we're not ready to go to conferences.
Yeah,
So Michelle, we gave Patient Power a big plug before you got on for Al, because I think was it Tom or Jack suggested that Al would find some good information on Patient Power for his PV.
Yeah, that was Jack. I won't steal the credit.
I think Jack is hosting something next week, maybe. Is that what's happening too? If not sooner, I don't know if it's this week or next week. Jack's supposed to be hosting something on multiple myeloma, but that's good. I guess he's back, and Al, that would be great. Many of us here have participated with Patient Power. Richard, I think you're now in touch with them.
Yeah, I am. Yep.
Tom, have you done
Indeed.
anything with Patient Power?
I haven't.
Oh my gosh. I will have to
You
let
will
them,
now, Tom.
maybe I'll bring you on.
Yeah.
I hear ya.
Yeah, I have something coming up. Maybe I can get you onto that one. But anyway, I'll send you
Alright.
some information. But
Okay.
he's been on a few times, I know.
Question for you myeloma patients, and maybe for Al too. So one of the things that's interesting is that there's now some data to show that CLL patients have a much higher mortality rate if they can track COVID-19. Is there that kind of study going on in the myeloma community or any of the other blood cancer communities that you guys are aware of?
Tom,
Myeloma crowd had I think there were 800 or 1,000 people doing data for COVID-19 and myeloma.
yeah, Tom, I would tell you that the latest word that I've gotten out of Dana-Farber Hospital in Boston is that there did not seem to be a direct correlation between the COVID-19 and multiple myeloma, or is specifically addressed by them, and then in the next sentence, or in cancer in general. Although, as we know, people with prior health issues who contract positive for the COVID-19 are much more likely to to have very significant problems and perhaps even death as a result of it. And I guess the data is pretty specific that most of the deaths in the country have been by people who have had prior medical issues.
Yeah.
I will tell you that I was told point blank by my oncologist when I asked the question, how careful do I need to be? And he said to me that if I tested positive and it went, it was high positive and I ended up in the hospital, that it would probably be fatal.
Hmm.
So,
Yeah.
we've been in quarantine a lot.
Yeah. There's actually a very small amount of data for CLL patients that show a 30% mortality rate. So when you look at the national overall mortality, 3 to 5%, we're significantly higher. So
Mhm.
I do have been really, really careful. It's not stopping me from doing stuff, but like we just traveled, as I mentioned earlier, to upstate New York. We don't go to any restaurants on the way. We bring food in the car with us. We stop in a rest area that's got like picnic benches, and we eat at a picnic bench outside at 2 o'clock in the afternoon instead of noon, when there's likely to be a bunch of people there as well. So, it's just been a matter of being really, really careful.
Really careful.
From an area in Florida that was experiencing, our county alone was getting like 600 new cases a day. And we went to a county in upstate New York that was having 4 to 10.
Yeah.
So sitting up there in my little camping trailer for the last month, I actually felt was a COVID avoidance technique.
Sounds like it was. We see a lot of those folks here in Maine.
Yeah.
Yep.
So Tom, do you think, so you didn't eat out at all when you were on the road?
We went to a couple of restaurants. So I will tell you that the further north I go, having traveled from Florida, upstate New York, the further north, the better the compliance with masks and hand washing and social distancing. In Florida, it's horrible. And that's why we still have 150 cases a day in my home county in Florida. And, we went to the grocery store here tonight at my house in North Carolina, and I would say 20% of the people didn't have masks on.
Oh, wow.
And it's like, but in New York, it was like compliance. We went to a restaurant, it was outdoor seating, had to wear a mask until you got to your table. When you sat at your table, if it was designed to seat 4 people, you couldn't pull up a 5th chair. They had a bar that was 2 seats, 6 feet distance, 2 seats, 6 feet distance, and big signs, no standing at the bar. So I think that they did a really good job up there of trying to maintain that. I felt comfortable, like I wasn't at risk. We stopped in a little store in Winchester, Virginia the other day, and I said to my wife, we got to get out of here. She goes, why? And I said, because I'm uncomfortable. All of a sudden, this place is filling up. They got aisles that are about 9 inches wide, and it's like you got a store that, maybe 20 people would be okay in there pre-COVID, but 20 people in there during COVID. So, so it's like the whole mindset has changed. So the good thing I think is we'll have less influenza this year. Because we got all these barricades for the cashiers and people are washing their hands. So I think we'll have less flu.
Have you had your flu shot?
Yes. We get recommended to get it. We get recommended to get flu, shingles, and pneumonia. I don't know about you guys.
I just sent my list of the recommendations to my primary care doctor, and he's setting them all up for me.
Yeah, for CLL, and I think it's probably the same for myeloma, it's no live vaccines.
Correct.
So,
Yeah, the other thing about the flu stuff that just hit the media is when to get your flu vaccine.
yeah,
And there's, even though the pharmacies all over this area are now heavily advertising, as are many of the health centers, the other piece of contrary news that's come out is it's way too early to be getting the flu vaccine, and that you should wait because the flu doesn't really hit until, I'm going to say, February. I think that's correct, but it may be January. But it has a life, at least for the old ones that I take. For those of you who are over 65, it has a very short lifespan.
so,
And
yeah,
so that's a real issue.
I think that's a bit of a wives' tale today,
Really?
that there is a lot of talk about that the flu shots are going to be hard to get later in the season. And the other thing to keep in mind is that cases early and are the time you get the shot for you to develop immunity. So I would say
Oh, say what it is.
No, I know.
He's not going to say it.
He froze on us.
We're losing you coming in and out, Tom. We're losing you a little bit on your internet. I think he's frozen.
Yeah.
I think they cut him off.
Yeah, they blocked them. Big Brother's watching.
Oh, he's gone. CDC, for whatever it's worth, reported in our newspaper today, said to take it mid-fall at the very earliest. So that's what the government is saying.
So
And do you believe the government?
Yeah, fair enough. Fair enough.
Uh-oh. I wonder, is Tom still on the road or is he back home? Did he say?
He's in North Carolina.
He
Oh,
ran to his trailer.
Yeah, it's in yeah. You know how in North Carolina, it's the sticks.
is he like in your backyard?
No, I'm in my backyard. Yeah.
So I saw something a while back, earlier this year, when they were talking about the COVID vaccine, and they had 3 different doctors on there, and they were saying that even though with the flu shot every year, I think it was only like 38% of the people in the United States that get it. Now, I've only had the flu shot twice. And both times that I've gotten it, I've gotten sick, and I've never had the flu in my life. And now here I am with the PV, and they're telling me to get the flu shot. I'm really scared.
What does your doctor say?
Yeah, they want me to get it.
Then get it.
That's normal protocol probably for what you have. I know I guess Tom was just saying, yeah, we're supposed to get pneumonia, flu, and I haven't been told shingles,
Yeah.
but maybe I'm not quite there yet on that.
Well, I'm on Enciclovar twice a day. Are they recommending the shingles shot rather than Enciclovar?
I'm on that. There's a protocol for what I was on. They still have me on it, the acyclovir 3 times a day, but Now you had talked to your doctor. Mine doesn't believe in my getting it. And the shingles, I asked her and she said, no, not yet. So I don't know if that's actually don't know. We need Tom to tell us if that's age
Michelle,
thing.
do you have MM or CLL?
I have CLL. It does seem we have, Al is our exception here. Well, and Rick, of course, but Al gives us another blood cancer. It seems we've mostly had just the two groups, CLL and multiple myeloma.
Mhm.
And Al, we need to get more people with what you have, I think, to get the conversation going even more for that. But it seems you have,
Or else we can cure it.
what'd you say?
Or else we can cure it. So and we just won't have more people have it. So we have fewer people with it.
That
So
is true.
I'm just wondering if Tom, your microphone is on. Are you still with us? Or are you without us? Let's see, what does it say about Tom? No, he's off. He's not with us. He's offline, so he must have lost his internet altogether, even though he shows he's offline. So we'll leave him there. So no.
We will miss you. We will miss you, Tom.
Yes, just when we needed him to find out about the, Al, October 1st, make a note, October 1st is the next meeting and hopefully Tom will be here and we can ask Tom on October 1st. I will tell you a couple of interesting things about these vaccinations. There are a couple of folks in the prostate cancer community who are in favor of all the vaccinations because they feel that it stimulates the immune system. And so there is a benefit, a systemic benefit in fighting cancer from the boost that the immune system gets from vaccines.
Who's left?
So,
All kinds of vaccines, you mean?
yeah, I mean, they say you should get the shingles shot, get the flu shot, the common vaccines that they recommend that you get. And they feel that there is a general benefit to that. I don't
I was
know.
surprised that after my stem cell transplant, I still had a positive titer for measles.
Huh,
Hmm.
interesting. Yeah.
I thought that, all your immunities went away, but I guess not.
Oh, well, now we can ask Tom. He's
Now we
back.
can ask Tom.
Ask Tom. So the question, Tom, the question that Al had was, we lost you, was he's very nervous about getting the flu shot because it's made him sick before. And he's only done it twice and he's gotten sick, but his doctors want him to get the flu shot. What's your take with respect to blood cancers regarding the flu shot?
So how long ago did he get it?
We just lost Al.
We just lost Al.
Dropping like
We are,
flies.
we are technology plagued tonight.
He said the last 2 years he's gotten the flu shot and gotten sick, but he's
Okay.
never had the flu.
Yeah.
Very good, Sally. We're gonna
Yeah.
make you like our reporter here.
The other question we had, Tom, was the Ciclovar versus the shingles vaccine.
So we're recommended to get shingles vaccine. The old shingles vaccine is a live vaccine, so we should not get that.
Yeah.
But the Shingrix, I got both doses. I got one last November and one in January. I personally had no side effects or issues with it. A lot of people don't understand that the Shingrix vaccine does not prevent you from getting shingles. It does reduce your risk. And when you do get it, if you get it, it's much less severe and it doesn't last as long. So that's the real benefit of the Shingrix vaccine.
What
So-
about a Ciclovar?
Well, that, can prevent shingles from re-erupting, but it's not guaranteed. Yeah. So
They
Al,
just kept telling me to take it, so I take it.
yeah. Wow, your flu shot, your doctor wants you to get it, I would get it.
Okay, all right.
Tom, quick question on that. So my, because I was on FCR and ibrutinib and then just ibrutinib for years, my oncologist doesn't want me to get Shingrix. She doesn't think it's, I don't know why. Either she doesn't think,
Yeah, there's a school of thought that says because our immune system is compromised, that we're not going to develop immunity to it. But, you know, I've had other vaccines that, you know, I've had titers done and they're positive. So it's really, you know, it's again, very, very one of those things where it might work for me, might not work for you. But the general consensus of the doctors, at least in the CLL world, is that that is a recommended vaccine. You know, and to kind of talk to that point, you know, I used to be a volunteer fireman and an EMT, and we had to get the hepatitis B vaccine, which was 3 shots. And this is way before I was diagnosed. I mean, it was when I was a young stud. You know, it wasn't, you know, like now. And
You're an
so,
old stud now?
yeah, maybe, I don't know.
Yeah.
In my own mind, I am, right?
Hey, Tom, I wouldn't go there if I were you.
Yeah, we're
Let it hang.
gonna clean it up a lot right now. But anyway, I never converted. And it was 30 years before I was diagnosed with CLL. So it's just my body never developed immunity to the hepatitis B. And I wound up having 6 shots instead of the normal 3. And it still never had immunity.
You were gone when I said that after my stem cell transplant, I think it was like 5 months after my transplant, they did a titer for measles, and I still had my antibodies for measles, even after the transplant.
That's great. You know, because they recommend that with stem cell transplantation, you get a lot of the vaccines over again. So
Well, that's why we tested it, because Santa Barbara had an outbreak of measles, and because normally our vaccines start like 18 months to 2 years after the transplant, and I was only like 4 months or 5 months. And so we went ahead and did a titer just on the measles alone, just to make sure in case I needed to get protection. And he said, no, you've got a 14, which is way high. So
yeah, so that's fantastic. So yeah, we know that we all react differently. I mean, you know, I think by and large, this group are your active people with a blood cancer, but there are some people that are bedridden. There are people that, you know, are extremely anxiety prone, and, you know,
depressed.
the end is coming. I just refuse to give up. And I just, you know, my personal approach is, you know, I can beat this thing, you know, and if I can't beat it, I'm going to stay on treatment as long as I can, because you know what, in 3 to 5 years, there might be some new thing that really is a cure. So.
Yeah, good for you, Tom. That's the best damn attitude I can think of. Talk about you know, adding value to your life, all of our lives. You know, the more that we think that way, the more that we really extend our life, our living, and make it better for ourselves and our families. You know, it's right on.
Yeah.
Right on.
That's why I elected to become a coach, because, you know, again, I don't know anybody else personally that has MM. I'd never heard of it before. I, started reading a lot of posts on Facebook, and people were terrified, and, they didn't know what they were talking about, and they had wrong information. And I have a very positive attitude, and I'm going to beat this thing. And I'm all for self-advocating. And I think that's necessary in this day and age.
one of the things I'm starting to see the more I get involved in like CLL advocacy is we have no idea how much better we are off in the United States as to compared to other countries. So even in the UK, which is considered to be, in a lot of cases, the level of knowledge of the average patient is not what I see with the patients that we have here in the US. So it's really, really encouraging to have. I think every discussion group I'm in, I'm encountering very enlightened and probably the most active patients that have a chronic illness.
Okay, well, I have a quick question for Michelle. Right before, because I see Mr. Capps is ready to go, because he's got to read a bedtime story, I know. How was your incubation group? Are you incubated?
Are you incubated?
It's going to take 6 months to be fully incubated.
Yeah.
6 months, but no, I am preliminary. I understand the terms for incubation now. I'm in called Writing to Heal, and it's an incubator, a writer's incubator. If that makes
Okay,
any sense. So more on that later. I'll know much more by next month, but yes, it's going to be 6 months of hard work.
well, just to remind everybody, we're switching again to the first Thursday in October, which will be October 1st in the month of October. And so we're going to the first Thursday in the month, and we'll send out the reminders just like always. And tell your friends, all these people that are in these other groups, they need to come in here and talk to us, because we don't bite and we're really quite friendly,
And I promise to do a better job this next month. I did a lousy job of posting and promoting this month, so I got
Okay.
distracted. I apologize. So we will do a much better job. We did do social media, but honestly, we waited until like the last couple of days to start doing it. So I apologize.
No worries.
We got
No-
distracted
no-
with this shakedown weekend. So
No worries. And I'm very proud of Sally for getting one of our shirts. Thank you, Sally. Be your own best advocate. Al, you need one of those shirts, man.
You got it.
Oh, you got it? You're on it?
I'm gonna get one. Yeah.
Okay.
So I got cut off. I think one of the technicians stepped on a cord here or something. But anyway, back to the flu shot. Does every one of you get the flu shot annually?
yes.
I have.
Yeah.
I was required to when I worked in healthcare, which was up until last year. So if you work in a hospital, but I will
Yeah. Mhm.
get it this year, on my own, just because it's
Yeah.
recommended for CLL patients.
I get
Well,
it.
folks, thank you so much. I really enjoyed this, even though it was a smaller group tonight. I really did appreciate it, and this was fun. As always, Rick, thank you for putting this together and making this possible.
No.
And it was lovely to see all of you.
Yes.
And so I really
Likewise.
look forward to seeing you again. But if I could put in a personal plug, Rick, if you don't mind, in next month on October 8th, 9th, and 10th,
Yep.
Throwing Bones is doing the Shakedown weekend. On the 8th, we are having a Shakedown dinner jam, which we're going to have music. So all of this stuff's going to be virtual. We're going to have our second webinar, which is on that Friday, October 9th, which is actually concerning purposeful movement for cancer patients. Talking about exercise and starting where you are, not necessarily where everybody thinks you should be. And then on Saturday, we are having the trail races. I don't believe, unless Tom wants to scoot up to the mountains, that anybody is local enough to come run our races locally, run or walk them locally. But we have virtual options. So we have a 5K, 10K, and a 1K. So run, walk, whatever it is, submit your times. We've got a really cool t-shirt that I'm happy to send to you. if you guys sign up or share it with others. So it's actually not a t-shirt. It's actually one of those thermal shirt, long sleeve thermal shirts are really nice this
Can
year.
you do 10K on the couch?
Well, I suppose you can. It will require a lot of bobbing up and down probably. As long as you can track it with a phone or a watch, works for me, wherever it happens. So, but so anyway, so y'all stay tuned. I'm certainly gonna annoy you about that over the next month, repeatedly. So, but thank you.
And I just, Richard, I know you forgot the question. If you remember the question, just drop me a line. My email is tomhenry@cllpharmacist.com.
Yeah, I will absolutely do that, Tom. So if it occurs to me, I'll be in touch.
You know, as soon as we log off, you're going to,
Shoot, I know.
Right,
Well,
I
you know,
wanted to,
it's because I'm older than you are.
I wanted
I
to
know
say
you're
one
not.
thing in that regard, which is that if
I've been to my
anybody
2
wants
years,
to,
Richard.
if anybody wants to connect to someone, just don't hesitate to reach out to us if you don't have their email, and we'll make sure we connect you. This
Okay.
actually came up yesterday as well. So but we're happy to connect people if you need to continue the conversation.
Absolutely.
And I think everybody is looks forward to supporting everyone else on this call. All right, well, we're going to say good night to everybody, and we'll see you October 1st.
All right.
Bye.
Bye.
Bye.